Welcome to Next Anatomy. We'll be talking about the blood supply to the spinal cord. When we see the foramen magnum, when we do the dissections in the cranium, when we remove the calvaris skull cap, and then when we reflect the meninges and the brain, and through the foramen magnum, there are two important blood vessels that are entering inside. Those will be the right and left vertebral arteries. And after they enters into the cranium, so now they joins together to form basilar arteries. So means right and left vertebral arteries will unite to form an important blood vessel that is called as the basilar artery. So now I'll be getting one tweak from the vertebral artery on the right side and one tweak from the vertebral artery on the left side. Both will merge with each other and they goes and joins together to form a single anterior spinal artery. So I can say that one anterior spinal artery, which was being seen in the anterior median fissure, and also in the cross section, we could able to say that anterior two-third portion of the spinal cord will be supplied by the anterior spinal artery. Same likewise, we could able to get a blood vessel either from both of the things, that is right vertebral artery and left vertebral artery. So we'll get off some branches on both the sides and we'll descend down as posterior spinal arteries. So there are two posterior spinal arteries, they are branching from the vertebral arteries. And also you could able to see segmental arteries during the descent of the spinal cord. And they reach as anterior and posterior radicular arteries. And these segmental arteries are in communication with the deep cervical, ascending cervical, posterior intercostal, either lumbar or anterior sacral arteries, they will branch off. And also you could able to see either anterior and posterior spinal artery, they also gives off longer branches. And especially in the anterior two-third aspect, you could able to identify a longer branch that is called as Arteria radicularis magna, which is called as the Artery of Adamkiewicz. As said, anterior two-third will be supplied by a single anterior spinal artery and right and left posterior spinal arteries to posterior spinal arteries will supply to the posterior one-third of the spinal cord. So that's why here in this cut section you could see it very clearly over here. The anterior median feature you had is the anterior spinal artery and they goes into the substance and they supplies until to the anterior two-third level until to the anterior two-third level will be supplied by the anterior spinal artery and the posterior one-third will be supplied by the posterior spinal artery. So we have radicular arteries even on posterior aspect and also in the anterior aspect also, but the longer one I'm going to call them as mentioned arteria radicularis magna or artery of Adamkiewicz. So these are our segmental arteries. As mentioned, they may take from ascending cervical artery or posterior intercostal nor lumbar nor lateral sacral artery or deep cervical. And we could able to see both the branches are joining together to form a single anterior spinal artery, but here directly they are descending down from the vertebral artery or least criteria from the posterior inferior cerebellar artery. So two vertebral arteries of the posterior aspect as two posterior spinal arteries, they descend down and supplies to the posterior aspect of the spinal cord. Here you can see anterior spinal artery. Here both the sides you could see the posterior spinal arteries. And also when we move on to the venous system here, these veins communicates with the intervertebral venous plexus. So all the veins, that is we will be having 6 longitudinal veins. That is I have 2 median longitudinal veins. And then I have 2 anterolateral veins and 2 posterolateral veins. So 2 and 2 and 2, total we have 6 longitudinal veins we could able to look it on. 2 longitudinal veins drains at the level of anteromedian fissure and the posteromedian sulcus. And we have two anterolateral veins. They are draining on either side of the anterior nerve roots. We could able to identify the anterior nerve root is over here. On either side, you had the anterolateral veins. That area will be drained off by my two anterolateral veins. Same counter opposite, we had posterior nerve root is emerging outside. On either side of the posterior nerve roots, I'll be having the posterolateral veins, and the venous drainage will be taken on, and all these veins will now communicate with the intervertebral venous plexus, and finally they leaves the foramina, and finally they empties into the vertebral venous plexus. Nor nearby posterior intercostal, nor lumbar, nor posterolateral sacral veins during the